In this video, we are going to be looking at the topic audiometry. Hi, I'm Aaron. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. Hearing is essential for communication and quality of life. Hearing loss affects all age groups and can impact learning, work, and social interaction. To detect hearing problems and measure it, we use a test called audiometry, which is considered the gold standard for hearing assessment. So, what is audiometry? It is a diagnostic procedure to measure hearing acuity. It determines the lowest intensity or threshold at which the sounds are heard by an individual, and it helps detect the type and degree of hearing loss. Types of audiometry. The first one is pure tone audiometry. It is the most common one. It measures air and bone conduction. Next, the speech audiometry. It tests the ability to detect and understand speech. The third is audiometry. It includes tympanometry and measurement of acoustic reflexes. This checks the middle ear function. Some of the special tests available are play audiometry, which is done for children, and brainstem evoked response. We'll be looking a little in detail to all of the mentioned methods. In pure tone audiometry, the patient wears headphones and is presented with different frequencies ranging from 250 to 8000 Hz. The thresholds detected are plotted on an audiogram. This audiometry compares air conduction versus bone conduction to differentiate conductive hearing loss, which is a problem in the outer middle ear, sensorineural hearing loss, which is due to inner ear or nerve damage, and the third one is mixed hearing loss, which can be due to both components. Another important test is speech audiometry. Here, instead of pure tones, the person listens to words. The speech reception threshold, SRT, is the lowest level at which the words can be recognized. The speech discrimination score measures the percentage of words repeated correctly at a comfortable loudness level. This test is especially useful in hearing aid fitting as well as in rehabilitation programs. Emittance audiometry. It includes two main parts, tympanometry and acoustic reflex testing. Tympanometry measures the movement of the eardrum and helps detect problems like fluid in the middle ear or eustachian tube dysfunction. Acoustic reflex testing checks the contraction of the small muscles in the ear when exposed to loud sound. These tests are especially important in diagnosing ear infections, middle ear disease, and even some neurological conditions. Next is play audiometry. It is a behavioral hearing test used in young children. It converts the hearing test into a game so that the child cooperates. It is a type of conditioned response audiometry. The principle in this is children may not respond reliably to normal pure tone audiometry. In play audiometry, the child is trained to perform a play activity like dropping a block, stacking rings, placing pegs every time they hear a sound. So this makes testing fun and keeps the attention. The procedure involves the child being seated with headphones. The audiologist demonstrates the task example. When you hear the beep, put the rock in the box. Frequencies and intensities are presented. Each correct response is rewarded or encouraged, and the thresholds are recorded and plotted on an audiogram. This method is best for children of age group of 2 to 5 years. For below 2 years, visual reinforcement audiometry is preferred, and above 5 years, children usually cooperate with standard PTA, that is pure tone audiometry. Wishman audiometry, VRA, it is a behavioral test for infants and toddlers aging from 6 months to 2 years. It uses visual rewards like flashing lights, animated toys, or video screens when the child responds to sounds. This is useful for early detection of congenital hearing loss. The principle in this type is The infants naturally turn their head toward a sound source. In VRA, this response is reinforced with a visual reward, encouraging the child to repeat the behavior. The procedure involves the child sitting on the parent's lap in a soundboard. Sounds of various frequencies are presented through speakers or earphones. When the child turns towards sound, a visual stimulus, as told earlier, a toy lighting up, a cartoon, or a puppet is activated. Over time, the child learns to expect the visual reward after hearing a sound. The hearing thresholds are determined and plotted on an audiogram. Brainstem evoke response audiometry. This is an objective electrophysiological test of hearing. This measures the brainstem's response to clicks or tone bursts delivered through earphones. This does not require an active response, thereby it's useful for infants, children, and uncooperative patients. The principal use here is the sound stimulus generates electrical activity in the auditory nerve and brainstem pathways. This activity is recorded using surface electrodes placed on the scalp and the earlobes or mastoids. Response appears as waves 1 to 7, each representing different parts of the auditory pathway. Let's look at the clinical use. It is used in newborn hearing screening, detecting retrocochlear pathology in cases such as acoustic neuroma and brainstem lesions, estimating the hearing thresholds in children and adults, diagnosing auditory neuropathy, monitoring auditory function during neurosurgery. This is an audiogram, which is a chart used to show the results of an hearing test. On the bottom, we have sound frequencies ranging from 125 to 8000, that is from low pitches to high pitches. Low pitches have the sounds like a drum or a bass, and whereas high pitches have the sounds of birds chirping or a whistle. And on the y-axis, okay, we have the loudness levels, okay, moving from quiet to loud. And the color band represents the degree of hearing. At the very top, 2 to 20 decibels, which is the normal hearing range. Below that is 20 to 40 decibels, which is mild hearing loss, where soft sound or distant speech may be hard to catch. Then from 41 to 55 decibels, it is moderate hearing loss, where everyday conversation becomes difficult without hearing aids. Then from 56 to 70 decibels, this is moderately severe hearing loss, meaning normal speech is often missed. Then from 71 to 90 decibels, it is referred to as severe hearing loss, where only very loud speech can be heard. And finally, anything above 91 is found to be referred as profound hearing loss, where even the loudest sounds may not be heard and cochlear implants may be considered. On the chart, we also see two symbols. The red circle representing the hearing test results of the right ear, while the blue cross or X represents the hearing of the left ear. This is the standard way audiograms show each ear separately. So by looking at this chart, an audiologist can quickly see not only how much hearing loss a person has, but also whether the loss affects low pitch sounds, high pitch sounds, or both. Finally, moving on to the role of nurse. The nurse plays a role in educating patients and families about hearing health, assisting in preparation and comfort during the test, supporting early screening in children as well as elderly, counseling on prevention, such as noise protection and ear hygiene, and collaborating with audiologists and ENT specialists. To conclude, audiometry is the cornerstone of hearing assessment. It not only identifies the presence of hearing loss, but also helps in determining its type and severity. As nurses and healthcare professionals, we play a vital role in promoting early screening, patient education, and long-term support. Remember, better hearing means better living. The forces for this particular video. Thank you for your patient listening.